This comment might suggest all this Centennial excitement and goodwill has made me a bit delusional, or maybe it's my being part of Princeton Health for almost 18 years. But I actually believe that all of you are personal friends, and I want to welcome you to my home. Thank you for your friendship and for helping to make Penn Medicine Princeton Health an extraordinary community resource. I'd like to acknowledge just a few of my friends. Joan Gallard, could you please stand? I hear yelling. Joan has worked here for 54 years in our environmental services. She is a great example of our dedication to our patients and their families. She well represents our 3,300 employees. Ward Cusser, could you please stand? Ward has been a volunteer here for 36 years and has donated over 10,000 hours of his time to help the people we serve. He's a great representative of the hundreds of dedicated, empathetic volunteers who are essential to our achieving our mission. Betsy Sands, Barbara Curtis, Nora Orphanides, Cynthia Scholl, could you please stand? You and your families have helped us and our organization in many ways, including your serving as past presidents of our auxiliary or chairs of one of our 53 June fetes and overseeing our White Elephant rummage sales. The Fete and the rummage sales were our hospital's largest fundraiser events for over half a century, and you represent the labor of love of hundreds of members of the auxiliary. Through their charitable works, the auxiliary helped us develop impactful new programs and provide care to thousands of uninsured and underinsured people. "200 physicians are here tonight representing our 1,300-member medical staff. I suspect that many of us are here because of them and their colleagues. Some of us wouldn't be anywhere if not for them. Doctors, could you please stand so we can thank you? My daughter, Dara, is going to have a baby any minute now, and my daughter-in-law, Becky, is expecting in January, so I want to talk about the future. When their babies are the average age of the people here tonight, they'll receive care that we can barely imagine today. They'll look back and shudder at what seems like the dark ages of healthcare, the way we think of operations without anesthetics or infectious treatments before the discovery of antibiotics. They might see sensors implanted in their bodies detecting signs of illness, which will then be analyzed and necessary actions sent to their bracelet. Instead of taking different tablets at different times of day at standard doses for different diseases, a printer may produce medications tailored to their genetic makeup and their body's individual requirements and delivered automatically below their skin. They may replace organs with enhanced bioprinted organs, like eyes with improved night vision. Their primary care physician may be an avatar, and tests may be run through a miniature portable lab in their home. Only the most extreme problems will be treated in hospitals. Their children might be injected with swarms of microscopic nanobots to swim around in their blood vessels, spotting problems and repairing them. I want to tell you why I believe Penn Medicine Princeton Health will be a vital part of that future. For 100 years, our doctors, nurses, and staff found their calling in caring for the people in our community. By anticipating their healthcare needs every step of the way, we've grown alongside the people we serve. When it comes to caring for your body and your mind, we answer the call. When changing times demanded innovation and technology, we answer the call. We've answered the call by partnering with Penn Medicine to bring access to groundbreaking research and breakthrough treatments of a world-class academic medical center right here for you. They are helping define the future of healthcare. More cures, more clinical trials, more options, more specialties, more convenience. Your futures are calling. We've learned to listen, plan, and deliver exceptional care and service, always striving to adhere to the highest ethical standards in all that we do. That 100 years of progress is now embedded in our DNA and equips us to exceed in the future. Thousands of people have given us financial resources necessary to be our best, and I believe they'll want to help us in the future. Together, Princeton Health and Penn Medicine are positioned to deliver extraordinary care to people living in central New Jersey for the next 100 years. Princeton Health has spent the last century preparing for the future. Penn Medicine has been working on it for over 260 years. Our past performance should give you the confidence in our ability to deliver an amazing future. Your life is our life's work. To the trustees, directors, physicians, staff, volunteers, clergy, donors, government officials, and other friends who had the vision, passion, and values to make us what we are today, thank you from the bottom of my heart. To the people who are working every day to serve our patients and make Penn Medicine Princeton Health better, you now have everything you need to be your best and to deliver exceptional care. To the people who come after us, we did our best and take good care of our grandchildren. Thank you. I'd now like to introduce the CEO of the University of Pennsylvania Health System, Kevin Mahoney.